importantly our colleagues from media who are here with us. We had concluded a series of meetings done in co-branding with our deputies meeting as well as the health ministerial meeting today. The meeting just got over. I would like to actually run through a small presentation primarily to cover the journey conducted. May I ask our team if they can confirm if it can be loaded, please? Distinguished colleagues, we had series of events done as part of our G20 Health Working Group. What I would like to highlight is that we had our first Health Working Group meeting in January in Thiruvananthapuram, Kerala. The meeting was also accompanied by a side event which focused on an area of topical interest, promoting value-based healthcare. And we had this side event on medical value travel. The second meeting was done in Goa. And we had also done a side event on discussing the advantages of digital health. This was also followed by a third meeting in Hyderabad, where we had side event also on collaboration on R&D in medical countermeasures. We completed our fourth Health Working Group meeting and Health Ministerial meeting today. And what I would like to highlight is that when we were conducting our Health Working Group meeting, the ministerial meeting, as per the guidance given by Honorable Minister, it also became an event where there were additional co-branded events which were also organized. If you see, we also had a G20 joint finance and health ministers meeting, which we just concluded and we are coming here. Besides that, we had 3 G20 co-branded events. First event was One Earth, One Health Advantage Healthcare event. This, as I submitted, this was focused on promotion of value-based healthcare. Second event was for promotion of traditional medicine. We are all aware that the Global Center for Traditional Medicine has been sanctioned by WHO in Jamnagar, Gujarat. So this was the first global summit for the Global Center for Traditional Medicine. Then the third event talked about the prowess of India in the medical devices sector, the medtech sector. So there was a medtech expo which was also organized. In totality, if you were to see, the congregation of all these events put together makes this one of the biggest event, a group event conducted focused on health in India in almost last few decades. What I would like to further highlight is that in the deputies meeting, which was conducted in Hotel Leela, deliberations covered all the 3 priorities of the G20 Health Working Group under G20 presidency. Deliberations required consensus. Deliberation required discussion amongst all the member states. A discussion which started 9:30 a.m. concluded at 2 a.m. in the night. And this was also preceded by 8 other discussions which were done virtually with all the member states and international organizations to gain consensus. And I'm happy to submit that we were able to gain consensus from all the distinguished G20 member state colleagues. And today that outcome document and chair summary has already been uploaded to Ministry of External Affairs website, wherein all the 3 priorities have been agreed by all the member states. If I were to highlight what are the 3 priorities which India has chosen for itself, you would all relate that these priorities are areas of very important topical interest. We all had challenges in terms of managing once-in-a-century crisis of COVID-19. That is, as part of that process, how do we remain equipped to manage any future health emergency or pandemic what should be done to see that we have a fit-for-purpose global health architecture. So therein, the first priority was about health emergencies, prevention, preparedness, and response. And when we talk about any health emergency management, India has specifically brought about the discussion on One Health as an ecosystem approach to be ready for any future health emergency, along with AMR, which we all treat as a silent pandemic. Second of our priority was focused on strengthening cooperation between G20 countries and through a broad spectrum, which also focused on ensuring availability and access to safe, effective, quality, and distinguished friends. I would like to specifically highlight the focus on affordability aspect, which was brought on the forefront by India's G20 presidency. And the third priority, which seamlessly interweaves these two priorities and which focuses on the health system strengthening, wherein how technology can be promoted in the health service delivery. So this was focused on digital health innovations and solutions to aid universal health coverage and to improve health service delivery. I would like to highlight that the outcome document chair summary was finally approved, and a session on the first priority of health working group was held on the day one of ministerial meeting. This was focused on, as I submitted, health emergencies PPR along with One Health and AMR. In this priority, keynote speaker included the Commissioner dealing with health issues, DG Sante from European Commission, Dr. Ashley Bloomfield, who is the co-chair of Working Group on International Health Regulation in WHO headquarters, primarily focused on identifying what changes are required in the international health regulation so that the globe is better prepared to manage any future health emergencies, and Dr. Vinod Paul, who is member of our Niti Aayog. The day also had two very interesting sessions, which were also something which was specifically decided by Honorable Minister of Health, which was the interface or combined session with Advantage Healthcare India event as well as the Global Center for Traditional Medicine Summit. These were the sessions where the G20 member states, the honorable members and delegates who visited the Global Center for Traditional Medicine Summit, and also the Advantage Healthcare event, all three set of audience came together and discussed on the issue related with traditional medicine promotion as well as also on the value-based healthcare. With respect to the first priority, I am happy to submit that we introduced the agenda of health emergencies PPR during India's G20 presidency in the first health working group, where we talked about prioritizing AMR. Then in the second health working group meeting, we discussed with the G20 member states that there is a need to map the ongoing initiatives so that there is less fragmentation in global health architecture. There is a defined seamless response when it comes to any health-related challenges. And we also talked about strengthening global One Health-based early warning surveillance as well as the surveillance of AMR consumption and use. Then the third health working group, we aligned ourselves with respect to the WHO's proposed mapping exercise. We also discussed clearly that climate change has a very important role. We are all observing whether it is heat wave, whether it is cold wave, whether it is floods and all other challenges, how climate change can impact the vector-borne disease, the water-borne disease, and how to that extent health system should be prepared. So this was an area which was discussed, and it was collectively agreed that in India we will be launching a climate and health initiative supported by Asian Development Bank. And in the last 2 days we had a consensus achieved on the need to focus on One Health AMR, on the need to focus on climate and health agenda, and this is what we were able to discuss and we were able to get consensus from member states. I submitted about Traditional Medicine Summit. This is the first ever event done by global event on traditional medicine organized by WHO headquarters. DG WHO was present here. There was participation for more than 70 countries, more than 400 delegates across the globe participated in this. This was also supported by an exhibition in 40,000 square feet of area, where from all the regions across WHO regions, whether it is AMRO region, whether it is CRO region, the ongoing efforts or ongoing use of traditional medicine was highlighted. I would just like to submit when WHO has done a survey, they found that more than 170 countries across the globe has some form or the other when it comes to use of traditional medicine. And we could get a lot of positive consensus from all the countries who reaffirmed the need to develop traditional medicine through evidence-based scientific and clinical research. The second event which we had was focused on One Earth, One Health Advantage Healthcare event. This event had more than 400 plus delegates and more than 110 exhibitors. The exhibitions included both the insurance sector, the health sector, the hospitals, the facilitators across the country. The best of India in terms of health was showcased there. 265 total MOUs were signed between Indian hospitals with the global representative who came here. This will lead to promotion of commercial activity between those countries, as well as it also reaffirmed through multiple panel discussion the focus on value-based healthcare and borderless access to high-quality healthcare. Participants and exhibitors included 163 private hospitals, 122 medical value travel facilitators, 64 government hospitals, 23 regulators, 22 government programmers, and 18 Ayush companies. There was participation from 11 medical associations from across the globe, and 5 global insurance companies were also present. The Advantage Healthcare portal was also launched. This I would like to submit. This portal becomes the single window approach which, under the directions of Honorable Minister of Health, we have launched during the event, wherein both patient mobility and health workforce mobility will be promoted. I am happy to submit once again the Advantage Healthcare portal to promote patient mobility already has 3 NABH and JCI accredited hospitals, and with 6,178 doctors covering 309 different specialties are already onboarded. So this portal has been launched. This is a multilingual portal. This will facilitate any global citizen to come to India and undertake treatment. Similarly, the other portal component is of health workforce mobility, which facilitate that any Indian doctor or a paramedical staff, if they are willing to provide their services to any other country in the globe, the portal will provide a transparent mechanism, required information and support in process so that those people can provide their services. Through these 2 portals, we believe that India's approach, as has been always envisioned by Honorable Prime Minister, that the One Earth, One Health approach will be proposed across the globe. Similarly, there is an event also organized on ending TB in the Southeast Asia region, and this event was organized in collaboration with WHO Southeast Asia region office, and event discussed India's TB elimination goal by 2025. There was a Gandhinagar declaration which was signed, and Gandhinagar declaration focused on eliminating TB in Southeast Asia by 2030. So to that extent, we were able to evolve consensus amongst Southeast Asia region 11 countries to work in a collaborative manner. We also had in the second day, the second session focused on our second priority, which is on pharmaceutical sector. Here, keynote speakers included Honorable Health Minister of Germany, co-chair of Intergovernmental Negotiation Body, and Mr. Pankaj Patel, the chairman of Zydus Life Sciences. I would like to specifically highlight that world is discussing what should be the next or official approach in terms of either a convention or an instrument or a treaty through the Intergovernmental Negotiation Body. As part of India's convergent approach, we had invited the co-chair of Intergovernmental Negotiation Body and discussed in terms of how the new proposed pandemic treaty and the pharmaceutical cooperation linkages can be established. In this, we reached a consensus on the urgent need to establish an interim global medical countermeasures coordination platform while the permanent mechanism is still being discussed in the Intergovernmental Negotiation Body. Going ahead, we had the third session focused on, so this just to highlight, we had introduced the agenda in the first health working group, where we had talked about a coordination mechanism so as to ensure that in case there is a health emergency, in an equitable manner across the globe, vaccines, therapeutics and diagnostics can be organized. Similarly, after that, we had discussed that it is important to launch an institutional approach and think in terms of a minimum viable product. G20 countries on the third health working group agreed for having a coordination platform as an interim measure. And this is what the consensus we were able to achieve. So this is again one thing I would like to submit to you. The third session focused on use of technology. We deliberated on the importance of how technology can help us achieve universal health coverage and what type of innovations are happening and how they can be integrated into the health sector. There was a clear discussion that these efforts need to be taken to their logical conclusion where countries are able to, in a transparent manner, get access to technology and the digital divide across the globe can be reduced. Honorable Minister has already offered to all the G20 countries that whatever technology solution India will prepare, they will be made available to the whole world as digital public good, made freely available to the whole world, so that global south, low and middle income countries can be supported and the digital divide to that extent can be reduced. A very important initiative which will converge the overall global action in digital health is in the form of Global Initiative on Digital Health. It was launched by DGWHO as well as the Honorable Minister, and then multiple organizations have already offered their financial support for this initiative, including Asian Development, BMGF, Children Investment Fund, etc. So this is again, I would like to submit a very clear deliverable in terms of a global initiative on digital health was launched. Then joint health and finance minister meeting was chaired by Honorable Minister of Health and Honorable Minister for Finance. All the ministers who attended this, they expressed their commitment for enhanced collaboration with Finance and Health Department, and 3 specific reports are launched. The report first concerned framework for economic vulnerabilities and risk, then the report on mapping of pandemic response financing options and gaps, and the report on best practice on finance health institutional element during COVID-19. In the end, I would just like to submit that there was a very clear focus on the declaration and declaration leading to action. We had participation from 29 honorable ministers from across the globe, and we also had the special virtual address by Honorable Prime Minister of India, Shri Narendra Modi ji, and in the joint finance and health minister meeting, we did discuss with respect to how the collaboration can be strengthened. So with this, maybe I would request Honorable Minister Sir to guide further. Sir.
So I would now request Madam S. Aparna. She's a Secretary, Department of Pharma, Government of India, for her remarks, please.
Thank you, Manisha, and thank you, Honorable Minister. The second priority of the Health Working Group focused on strengthening collaboration in the pharmaceutical sector in order to ensure the access and availability of safe, quality medical products and countermeasures, including vaccines, therapeutics, and diagnostics. The outcome document does recognize the need for strengthening, on one hand, the local and regional health product manufacturing capabilities, and on the other, the global and regional R&D networks to facilitate access to VTDs globally, particularly in developing countries. This outcome has been achieved through sustained effort through the entire cycle of meetings. We had organized co-branded events along with partners such as FIND, PATH, WHO, DNDi to focus attention on the need for working together collaboratively, particularly on early stage research in diagnostics, vaccines, and some of the important therapies that will enhance pandemic preparedness. Also, a side event was organized at Hyderabad to bring attention to the priority. In addition to that, in the current working group meeting, we also had the opportunity to organize the first ever Indian MedTech Expo 2023, which was organized at the Helipad exhibition ground. And the purpose of this expo being organized alongside the G20 Health Ministers meeting was to showcase the strength and potential of the Indian MedTech sector, the Indian medical devices industry, and its contribution and potential to contribute to the priority of access to affordable quality and effective medical devices for diagnostics, etc. The focus of the exhibition was on showcasing the quality, the level of innovation, and the competitiveness of Indian products in the country, both domestically manufactured and also by global MNCs with a presence in India. This was perhaps the largest ever expo held on this sector. The theme of the expo was India, the next MedTech global hub, future of devices, diagnostics, and digital, bringing together the tools such as AI and ML. It witnessed large-scale participation from both global and Indian companies, including MSMEs, startups, research institutions, state governments, regulators, and procurement agencies. About 225 companies, including, as I mentioned, MSMEs, participated. 7 states showcased their efforts to enhance and attract investments in the medical device sector so as to build self-reliance, and also contribute to integrating the Indian medical devices sector to the global value chain. There was also a special pavilion to showcase the R&D work that is going on in the medical devices sector, and 58 projects were demonstrated there by both companies as well as academic institutions. 80 startups, which were also very much appreciated by the G20 delegates who had the opportunity to visit the expo, were also showcased in a special pavilion. And lastly, there was a special pavilion organized for the future of medical devices in terms of non-invasive, digital, remote diagnostics, and 74 future technologies were showcased from 65 companies and various organizations. There were also very healthy and meaningful discussions among the stakeholders, which included a range of discussion from cybersecurity to geriatric care and the role of medical devices in aged health management. We also focused on new methodologies for procurement to ensure that medical devices are available in the public health system, and demand forecasting to help industry to increase investment in this growing sector was also made. This was not just a domestic event. There was a buyer-seller meet organized in which we had participation from from 47 countries in the form of about over 200 buyers, both from the private and from government sector, and 4,157 meetings were organized between the buyers and the suppliers. This event had an unprecedented footfall of over 10,000 visitors in a period of about two days, and does, I believe, demonstrate the capability of medical devices sector to cater to Indian and global demand, the importance that diagnostics and devices are gaining in overall healthcare, and the commitment that we have to ensure access and availability of safe, effective, and quality healthcare products. Thank you.
Thank you, ma'am. I now request the Honorable Minister, Dr. Mansukh Mandaviya, sir, the Union Minister for Health and Family Welfare and Chemicals and Fertilizers, for his address, please, sir.
थैंक यू। जर्नलिस्ट टीम को वन साइड सुनना बहुत दिक्कत होती है ना, लेकिन डिटेल इन्फॉर्मेशन देने की कोशिश की है ताकि एक होलिस्टिक G20 में हेल्थ मिनिस्ट्री में क्या हुआ, फर्स्ट, सेकंड, थर्ड, ऑफिसर लेवल की मीटिंग, आज मिनिस्ट्रियल लेवल की मीटिंग। दोस्तों, मैं आपको बताना चाहूँगा कि अपने आप में G20 हेल्थ मिनिस्ट्रियल मीटिंग ये विशेष और ख़ास हो गई है। यहाँ आपको प्रेजेंटेशन में बताया 3 कार्यक्रम हुआ, कुल मिला के 29 मिनिस्टर उपस्थित रहे। एक ट्रेडिशनल मेडिसिन का पहली इंटरनेशनल कॉन्फ्रेंस हुई और वो भी उसकी मेज़बानी इंडिया को करने का अवसर मिला, वो अपने आप में खास है। दूसरा, एक ही परिसर में एक ही टाइम पे मेडिकल वैल्यू ट्रैवल्स, मेडटेक एक्सपो एक साथ में होना, दुनिया के 71 से अधिक कंट्री का डेलीगेशन आना, 1500 से अधिक डेलीगेट्स आना और 300 से अधिक MOU होना अबाउट ओनली मेडिकल वैल्यू ट्रैवल्स के लिए, यानी कि मेडिकल टूरिज्म के लिए इंटरेस्टेड स्टेट, इंटरेस्टेड इंटरनेशनल हॉस्पिटल, अदर कंट्री की हॉस्पिटल जिन्होंने इंडिया की हॉस्पिटल के साथ MOU करा ताकि भविष्य में अपने कंट्री के पेशेंट वो इंडिया में भेज पाए। दोस्तों, 3 एक्सपो, मिनिस्ट्रियल हेल्थ मिनिस्टर समिट, गुजरात को उसकी मेज़बानी करने का अवसर मिला। सभी डेलीगेट्स ने, खास करके मिनिस्टर लोगों ने गुजरात की हॉस्पिटलिटी की सराहना की। जिस तरह से यहाँ स्वागत किया गया, उसकी व्यवस्था की गई, कल्चरल कार्यक्रम किया गया, उससे बहुत उत्साहित थे। दोस्तों, WHO के डायरेक्टर डॉक्टर टेड्रोस ने, मोदी जी ने देश में 1,56,000 से अधिक हेल्थ एंड वेलनेस सेंटर बनाए हैं। वो गांव में जाके एक हेल्थ एंड वेलनेस सेंटर की मुलाकात की। हेल्थ एंड वेलनेस सेंटर पर सेंट्रल गवर्नमेंट और स्टेट गवर्नमेंट के द्वारा मुफ्त मेडिसिन दी जाती है। वहाँ 23 टाइप के स्क्रीनिंग किए जाते हैं। वहाँ पर वैक्सीनेशन किया जाता है। वहाँ से प्लानिंग होता है, वहाँ से टेली कंसल्टेशन होता है। दोस्तों, गांव के कोई सामान्य व्यक्ति, गरीब व्यक्ति 5-6 हज़ार के पॉपुलेशन पर एक हेल्थ एंड वेलनेस सेंटर होता है, वहाँ पर वो आ जाते हैं और आवश्यकता होती है तो हेल्थ एंड वेलनेस सेंटर के डॉक्टर या तो कम्युनिटी हेल्थ ऑफिसर संजीवनी प्लेटफॉर्म का उपयोग करके डिस्ट्रिक्ट हॉस्पिटल के साथ जुड़ जाते हैं। डिस्ट्रिक्ट हॉस्पिटल के स्पेशलिस्ट डॉक्टर डिस्ट्रिक्ट प्लेस पर बैठ के उसको एडवाइस कर देते हैं। आवश्यकता होती है तो वो सीधी भी उसके साथ बात करते हैं, डॉक्टर से भी बात करते हैं। एक बहुत बड़ा रिवोल्यूशन है डॉक्टर टेड्रोस ने देखा और उन्होंने कहा कि विश्व के कई देशों को इस टाइप का मॉडल अडॉप्ट करना चाहिए। उन्होंने सराहना की। आज विश्व के देशों ने, विश्व में हिंदुस्तान फार्मेसी ऑफ द वर्ल्ड तो है, लेकिन आज सभी डेलीगेट्स बोल रहे थे और उसका ओपिनियन से वो बोल रहे थे कि आने वाले दिनों में हम हॉस्पिटल ऑन अर्थ होंगे, यानी कि दुनिया ट्रीटमेंट कराने के लिए इंडिया में आएंगे, ऐसा विश्वास ये लोगों ने व्यक्त किया। दोस्तों, कई लोगों ने अपनी बात रखी और ये भी हम सब लोगों के लिए प्राउड है। हमारे नीदरलैंड के स्वास्थ्य मंत्री ने कहा, ड्रग्स डेवलपमेंट, वैक्सीन इनोवेशन इन हेल्थ केयर और डिजिटलाइजेशन से वो बहुत काफ़ी प्रभावित हुए। उन्होंने देखा कि इंडिया में जिस तरह से इनोवेशन हो रहा है, डिजिटल टेक्नोलॉजी का इस्तेमाल हो रहा है, वो आने वाले दिनों में इंडिया को तो मदद करेगा लेकिन दुनिया को भी मदद करेगा। हमारे जर्मनी के हेल्थ मिनिस्टर ने कहा कि हम जेनेरिक मेडिसिन को प्रोक्योरमेंट करने के लिए इंडिया को प्रायोरिटी देंगे, क्योंकि इंडिया में क्वालिटी और एफोर्डेबल मेडिसिन मिलती है। कई लोगों ने एक्सपो में जन औषधि केंद्र का मॉडल देखा और मुझे कहा कि हमें देखना है कैसे आप इतनी सस्ती और क्वालिटी मेडिसिन देते हैं। मैंने बताया कि देश में 9,500 से अधिक जन औषधि केंद्र है। वहाँ ब्रांडेड मेडिसिन के सापेक्ष में 25% में, 30% में, मैक्सिमम 50% में, लेकिन क्वालिटी मेडिसिन मिलती है, उसकी भी सराहना की। इजिप्ट के हमारे हेल्थ मिनिस्टर ने कहा कि भारत की भूमि को देखकर मैं अभिभूत हूँ। वो बहुत खुश हुए, हॉस्पिटलिटी के लिए भी बहुत खुश हुए। और दोस्तों, प्रधानमंत्री जी ने एक कॉन्फ्रेंस को वर्चुअली संबोधित करते हुए कहा कि आने वाले दिनों में ऐसा कोई पेंडेमिक आए तो उसके लिए विश्व को सज्ज रहना चाहिए। ये विषय भी हमने G20 के हमारी प्रायोरिटी एरिया में रखा। अच्छी तरह से G20 के हेल्थ मिनिस्टर ने उसके ऊपर डिस्कशन किया और सब लोगों ने सहमति बताई कि हमें उसके लिए तैयारी करनी चाहिए। दोस्तों, कुल मिला के हेल्थ मिनिस्टर समिट G20 की बहुत यूज़फुल रही। आने वाले दिनों में उसकी इफ़ेक्ट विश्व में सबको हेल्थ एक्सेसिबल हो, सबको हेल्थ अफोर्डेबल हो, वैक्सीन और मेडिकल ट्रीटमेंट सभी को, गरीब कंट्री को अमीर कंट्री के इक्विवेलेंट मिले। पेंडेमिक कोई आए, ऐसे पेंडेमिक की सिचुएशंस में दुनिया साथ में मिलकर तैयारी करे ताकि भविष्य में ऐसे कोई पेंडेमिक आए तो उसको उसके सामने अच्छी तरह से लड़ पाए, उसका सामना कर पाए। और हमें कोविड क्राइसिस में जो सीखा उससे प्रेरणा लेके कोई एक देश कभी हेल्थ सेक्टर में सेफ नहीं हो सकता है। हेल्थ सेक्टर में सभी दुनिया साथ में मिलकर प्रयास करे। एक देश के अलावा सब लोग साथ में मिलकर प्रयास करने से सब लोग सलामत हो जाते हैं, क्योंकि हेल्थ सेक्टर कोई स्टेट, कोई कंट्री का सेक्टर नहीं है, वो वैश्विक सेक्टर है। ये G20 में सभी ऑनरेबल हेल्थ मिनिस्टर ने अपने डिस्कशन में बात रखी, उससे फलित होता है और विश्व साथ में मिलके इस दिशा में प्रयास करेंगे तो मुझे लगता है कि हम अवश्य ऐसे कोई पेंडेमिक के सामने अच्छी प्रिपेयरनेस कर पाएंगे। दूसरा दोस्तों, विश्व ने ये भी महसूस किया, और जब 1-to-1 हमारी मीटिंग हो रही थी और अपनी भी बात में वो विषय रख रहे थे, तब पेंडेमिक के दरमियान, कोविड क्राइसिस के दरमियान हिंदुस्तान ने जो अपनी भूमिका रखी, अपना रोल अदा किया, अपना दायित्व निभाया। दोस्तों, हिंदुस्तान के लिए हेल्थ कभी कॉमर्स नहीं है, हिंदुस्तान के लिए हेल्थ है सेवा है। और ये सेवा भाव दिखाते हुए 150 से अधिक कंट्री में हिंदुस्तान ने मेडिसिन पहुंचाई। 100 से अधिक कंट्री में जब दुनिया वैक्सीन का स्टॉक पाइलिंग कर रही थी, तब हिंदुस्तान ने वैक्सीन देने का काम किया। ये भी एक क्राइसिस की स्थिति में इंडिया ने उसको कॉमर्स नहीं देखा। पहले जिस प्राइस में वो मेडिसिन देते थे वही प्राइस में मेडिसिन दिया। उस वक्त चाहा होता कि हमें प्राइस बढ़ाना है तो बढ़ा सकते थे, लेकिन हिंदुस्तान ने नहीं बढ़ाया। सस्ते में क्वालिटी मेडिसिन उपलब्ध कराई, वैक्सीन उपलब्ध कराया। दोस्तों, आउटपुट ये निकला कि आज दुनिया हिंदुस्तान के प्रति विश्वास से देखती है। दुनिया मानती है कि क्राइसिस की स्थिति में हमारे साथ खड़े रहने वाला कोई कंट्री है तो उसका नाम हिंदुस्तान है, इंडिया है। इसलिए दुनिया इंडिया के साथ बायलैटरल कोऑपरेशन इन हेल्थ सेक्टर में करना चाहती है। दुनिया मेडिसिन का प्रोक्योरमेंट मैंने G20 हेल्थ मिनिस्टर समिट में 3 दिन में सभी के साथ बातचीत करते हुए महसूस किया। मैं मानता हूँ कि ये मीटिंग भारत के लिए, विश्व के लिए आने वाले दिनों में हेल्थ सेक्टर में आमूल चूर परिवर्तन करने वाली होगी। हॉलिस्टिक अप्रोच के साथ हेल्थ सेक्टर में काम करने का विजन गांधीनगर की धरती से दुनिया में गया है। मैं विश्वास करता हूँ कि सारी दुनिया एक साथ में मिलके हेल्थ सेक्टर में काम करे, विश्व का हेल्थ अच्छा रहे, विश्व की सेहत अच्छी बनी रहे, ऐसी कामना करते हुए इस इवेंट को, इस समिट को मीडिया ने भी, मैंने देखा, अच्छी तरह से कवरेज किया। गुजराती मीडिया, हिंदी मीडिया, इंग्लिश मीडिया, सभी को मैं हार्दिक बधाई देता हूँ, शुभकामनाएं व्यक्त करता हूँ। धन्यवाद।
Dhanyawad, sir. Thank you, sir. Sir, we are very happy to inform you that we have 27 media persons from G20 countries. They have visited the MedTech Expo today and they are sitting amongst us, sir. So welcome to all of you. Very special welcome. The floor is now open for questions from the media friends, please. Please raise your hand when you pose the question and kindly introduce yourself.
जितेंद्र, तेरा माइक चालू कर भाई। दूसरा हैंड सेट हो तो दो।
हेलो, नितेंद्र हूँ दूरदर्शन न्यूज़ से। अभी जो डिजिटल हेल्थ पे इनिशिएटिव लॉन्च हुआ, तो उसके पीछे मकसद क्या है? इससे क्या बेनिफिट होगा देश के लोगों को और बाकी दुनिया के लोगों को?
बहुत अच्छा क्वेश्चन है। जो मेडिकल वैल्यू ट्रैवल के लिए डिजिटल पोर्टल को लॉन्च किया गया, वो हिंदुस्तान का सॉफ्ट पावर को इंगित करता है। ये डिजिटल प्लेटफॉर्म के द्वारा दुनिया के लोग इंडिया में ट्रीटमेंट कराने के लिए आना चाहे तो एक ही प्लेटफॉर्म पर जाके इंडिया में कौन सी बेस्ट हॉस्पिटल है, NABL एक्रीडेटेड हॉस्पिटल कहाँ है, कौन से एक्सपर्ट डॉक्टर है, उसका पैकेज क्या है, कहाँ जाना है, सारी इन्फॉर्मेशन एक ही प्लेटफॉर्म पर उसको मिल जाए। ये प्लेटफॉर्म का एक ये उद्देश्य है। उसमें ही एक व्यवस्था है। इंडिया में 1.3 मिलियन डॉक्टर्स है, 3.5 मिलियन 35 लाख नर्सिस है, 8 लाख आयुष के डॉक्टर हैं। दोस्तों, ये हमारी ताकत है। इंडिया में टेक्नीशियन है, ट्रेन मैन पावर है इन हेल्थ सेक्टर। दुनिया के हॉस्पिटल को कोई मैन पावर चाहिए तो एक प्लेटफॉर्म पर वो जाएंगे, वहाँ से उसको सारी इन्फॉर्मेशन मिल जाएगी कि कौन सी बेस्ट एजुकेशनल नर्सिस इंस्टीट्यूट है, मेडिकल कॉलेज है, पैरामेडिक के लिए अभ्यास करने वाले इंस्टीट्यूट है। उसको ये प्लेटफॉर्म से इन्फॉर्मेशन मिलने से वो उसका कांटेक्ट कर पाएंगे और अपने यहाँ वो मैन पावर को रिक्रूट कर पाएंगे। फॉर एग्जांपल, दुनिया अपनी बात को रखना है तो भी ये विषय पर रख पाएंगे। जापान ने कहा कि हमें नर्सिस चाहिए, लेकिन वो जापानीज लैंग्वेज बोले ऐसी होनी चाहिए, और उन्होंने कहा कि हम नॉर्थ ईस्ट से आए उसको प्रायोरिटी देना चाहते हैं। तो हमने नॉर्थ ईस्ट में 3 नर्सिंग कॉलेज में जापानीज लैंग्वेज पढ़ाना चालू कर दिया, और आज हमने सेकंड लैंग्वेज के रूप में फ्रेंच, अरेबिक, जापानीज, स्पेनिश, ऐसी कई लैंग्वेज में सेकंड लैंग्वेज के रूप में उसको पढ़ाना चालू किया है, ताकि उसको जब नर्सिस की आवश्यकता हो और वो हमारी नर्सिस वहाँ जाना चाहे तो उसको अच्छी जॉब मिल पाए और उसको लैंग्वेज बैरियर ना रहे। ये दृष्टि से 2 महत्वपूर्ण फ़ायदा है। एक, दुनिया को यहाँ ट्रीटमेंट कराने के लिए आना है तो उसको ऑथेंटिक इन्फॉर्मेशन मिले, कोई बिचौलिया के पास जाना ना पड़े। दूसरा, यहाँ से हमारा मेन पावर को दुनिया में जाना है तो वहाँ से ही इन्फॉर्मेशन मिल जाए और उसकी खराई भी हो जाए कि कोई बिचौलिया नहीं है ना, जो रिक्रूटमेंट के लिए हमसे बात रख रहे हो वो सही है ना। ऑल इन्फॉर्मेशन एक ही प्लेटफॉर्म पर मिले, इसलिए उसका महत्व है।
Thank you,
हेलो सर, सोहिनी हियर फ्रॉम इंडियन एक्सप्रेस। एक चीज़ पूछना था कि एक हमारा फोकस एरिया है डिजिटल सिस्टम हेल्थ इंफ्रास्ट्रक्चर में, एंड एट द सेम टाइम जो आउटकम स्टेटमेंट आया है उसमें सिक्योरिटी को इंक्लूड करने से इनकार किया है चाइना ने बेसिकली। सो गिवन दैट साइबर सिक्योरिटी भी एक इशू रहता है विथ एनी सॉर्ट ऑफ डिजिटल इंफ्रास्ट्रक्चर, तो इसके साथ आप कैसे डील करेंगे?
साइबर सिक्योरिटी स्वाभाविक है, नॉट ओनली फॉर इंडिया, नॉट ओनली फॉर आवर डिजिटल प्लेटफॉर्म एंड नॉट ओनली फॉर हेल्थ डिजिटल प्लेटफॉर्म। ऑल टाइप ऑफ डिजिटल प्लेटफॉर्म पर साइबर अटैक के सामने सिक्योरिटी आवश्यक होती है, और इंडिया जो भी डिजिटल प्लेटफॉर्म हेल्थ के लिए तैयार कर रहा है उसमें 3 लेयर साइबर सिक्योरिटी रखते हैं और डे टू डे उसको ज़्यादा से ज़्यादा प्रूवन बनाया जाता होता है ताकि भविष्य में कोई डेटा के ऊपर इफेक्ट ना आए।
सही है सर, जो हमारा आउटकम डॉक्यूमेंट है इसमें इंडिया के लिए सबसे इम्पोर्टेंट हाइलाइट्स कौन कौन से हैं?
हमारा जो आउटकम डॉक्यूमेंट का आउटपुट ये निकलेगा कि हमारे लिए एक resilient, equitable and sustainable and inclusive health care, ये 4 विषय को एश्योर करने के लिए हम लोगों ने बहुत अच्छा डिस्कशन किया है और यूनानिमसली सब लोगों ने उसको सपोर्ट किया है।
सर इधर राइट साइड से, मेरा नाम परीक्षित है और मैं अमर उजाला न्यूज़पेपर से हूँ सर।
कहाँ है
आपको
परीक्षित?
सर
यस,
बहुत सारी बधाइयाँ सर। पिछले 8 महीने से जो लगातार मंत्रालय मेहनत लगा रहा था और अभी सारी चीज़ें हमारे एजेंडा पूरे सारे सक्सेस हो गए, इसके लिए बहुत बहुत बधाई।
आपको जो विदेश से आए थे उसको भी पूछना चाहिए कि कैसा लगा है।
हाँ सर, उनसे भी पूछा,
बधाई तो
लगातार
देता है
पूछा।
लेकिन उसको पूछ।
और उनको देख के बड़ा खुशी हुई कि इतना वो तारीफ करके गए वो हम लोगों की। तो सर मेरा सवाल था कि जो महामारी कोष को लेके जो अभी बातचीत हुई थी, तो पिछले साल इंडोनेशिया में वो शुरुआत हुई थी और अभी हम यहाँ आ गए हैं, तो अभी कुछ इस बैठक में महामारी कोष को लेके क्या कुछ नया डेवलपमेंट हुआ है?
कोष मीन्स लो
इसके बारे में
फंड कोष,
महामारी कोष, पैंडेमिक फंड।
हाँ
हाँ सर, आपको कोई भी बता सकता है सर।
देखिए, 2 चीज़ें हैं। पहली बात तो ये है कि इसमें जब हमने हेल्थ इमरजेंसी की बात की, तो हमने हेल्थ इमरजेंसी के तीनों एस्पेक्ट, प्रिवेंशन पर, प्रिपेयर्डनेस पर और रेस्पॉन्स पर विश्व में एक प्रॉपर स्ट्रैटेजी होनी चाहिए, उसके ऊपर विषय पे बड़ी विस्तृत चर्चा हुई। दूसरा, उसी के समय में जब हम बात करते हैं हेल्थ इमरजेंसी की, तो कभी भी फिनेंसिंग एक बहुत इंपॉर्टेंट एस्पेक्ट है। पिछले साल जब इंडोनेशियन प्रेसिडेंसी थी, तब इंडिया ने उसमें काफ़ी सपोर्ट देकर एक पेंडेमिक फंड का लॉन्च कराया था। अगर आप देखें जिस समय वो फंड लॉन्च हुआ था और आज जब हमने जॉइंट हेल्थ एंड फाइनेंस मिनिस्ट्रियल मीटिंग में बात की, तो मैं आप लोगों को सूचित करना चाहूँगा कि उसमें $2 बिलियन विश्व की तरफ से इकट्ठा हुआ है। दूसरा एक और पॉजिटिव डेवलपमेंट ये हुआ है कि उस पर्टिकुलर फ्रेमवर्क में पेंडेमिक फंड की तरफ से फर्स्ट कॉल फॉर प्रपोजल भी लॉन्च किया गया, यानी कि विश्व से कहा गया कि आप पहला प्रपोजल हमें भेजिए जिसको हम सैंक्शन करेंगे। और उस प्रपोजल के तहत विश्व के कई देशों ने, कई ऑर्गेनाइजेशन ने उसमें अपना प्रपोजल सबमिट किया और आने वाले कुछ ही दिनों में लगता है कि वो पहला कॉल फॉर प्रपोजल का सैंक्शन ऑर्डर भी आ जाएगा। तो यानी कि एक तरफ तो फंड लॉन्च हुआ, उसके बाद हम जॉइंट फाइनेंस एंड हेल्थ टास्क फोर्स की तरफ से और हेल्थ वर्किंग ग्रुप की तरफ से उस पेंडेमिक फंड से कंटिन्यूस बेसिस पे जुड़े हुए हैं और जुड़ते हुए हमने फर्स्ट कॉल ऑफ प्रपोजल को भी एक स्टेज तक ले आए हैं और अब विश्व में उसके अंतर्गत कार्य शुरू होगा। उसमें 2-3 मुख्य अंश रखे गए थे जो फर्स्ट कॉल फॉर प्रपोजल में थे। सर्वेलेंस पर फोकस किया गया था, हेल्थ वर्कफोर्स स्ट्रेंथिंग पर फोकस किया गया था, ये 2, और एक और मुख्य अंश रिसर्च के ऊपर फोकस किया गया था। तो इन तीनों चीज़ों को हाईलाइट करते हुए अब विश्व में उसके अंतर्गत कार्य किया जाएगा।
Thank you, sir. Our friend
Mr. Minister, my name is Pablo from ABC Spanish daily newspaper. Thank you very much for having us here. I am one of the delegation of G20 countries who came here. It's a real pleasure to be here. I would like to ask you about the pandemic that now looks like never existed, but 2 years ago, unfortunately, India was one of the countries that was most seriously hit by the pandemic. So, what did you learn from that experience, and how can the G20 help WHO, which director was here today, in order to avoid other pandemic like that one, or avoid such a high number of deaths, especially biggest producers of medical and pharmaceutical products? Thank you very much.
उसको कोई ट्रांसलेट कर देना भाई। मैं तो बोलूँ लेकिन उसको आप बोलो, इंग्लिश में बोलो तो समझेगा। मेरी इंग्लिश वो आधी अधूरी होगी। उसमें नॉट ओनली फॉर इंडिया बट सारी दुनिया पेंडेमिक से सीखी है। हम भी, इंडिया ने भी उसके लिए लेसन लेते हुए हमारा हेल्थ इंफ्रास्ट्रक्चर में क्या लैप्सिस है और क्या प्रिपेयर्डनेस करने की आवश्यकता है, तो वी हैव टेकन टू इनिशिएटिव 64,000 करोड़ रुपीस नेशनल हेल्थ इंफ्रास्ट्रक्चर मिशन वी हैव लॉन्च्ड। और 64,000 crore rupees means one district 100 crore rupees we spend coming 4 years। अगले 4 साल में हम 64,000 crore rupees इन्वेस्ट करेंगे, उसमें ब्लॉक टू डिस्ट्रिक्ट टू स्टेट टू रीजनल लेवल और सेंट्रल लेवल। एक हम एपिडेमियोलॉजी लैब तैयार करेंगे, लैब की श्रृंखला करेंगे, ताकि कोई डिसीज़ नीचे चलता हो तो तुरंत ही उसका पता सेंट्रल लेवल पर चले और उसकी प्रिपेयर्डनेस के लिए सुविधा रहे। दूसरा, इस बार हमने इमरजेंसी में देखा डिस्ट्रिक्ट प्लेस पर हेल्थ इंफ्रास्ट्रक्चर कम हो गया, तो उसके लिए एक हर डिस्ट्रिक्ट में 100 बेड का क्रिटिकल केयर यूनिट भी वहाँ बनाया जा रहा है। हेल्थ इंफ्रास्ट्रक्चर के लिए हॉस्पिटल को, डिस्ट्रिक्ट हॉस्पिटल को टर्शरी केयर के लिए सुसज्ज की जा रही है। तो इंडिया ने जो किया है, दूसरा वैक्सीन और फार्मास्यूटिकल सेक्टर में तो इंडिया लीड कर ही रहा है। वैक्सीन की विश्व की रिक्वायरमेंट की 60% वैक्सीन इंडिया प्रोवाइड करता है, लेकिन दुनिया ने भी ये लेसन लिया है कि एक ही सेक्टर में, निश्चित कंट्री में ही वैक्सीन मैन्युफैक्चरिंग एंड मेडिसिन मैन्युफैक्चरिंग नहीं होना, मैन्युफैक्चरिंग केवल ही नहीं होना चाहिए, लेकिन कॉन्टिनेंटल वाइज सभी कॉन्टिनेंटल में वैक्सीन मैन्युफैक्चरिंग होना चाहिए। कंट्रीज समूह के बीच में वैक्सीन मैन्युफैक्चरिंग होना चाहिए, मेडिसिन का मैन्युफैक्चरिंग होना चाहिए, ताकि ऐसी क्राइसिस स्थिति में कोई सुविधा से, हेल्थ केयर से वंचित ना रह जाए। उसके अलावा यू वांट टू ऐड एनीथिंग?
So, Honorable Minister has mentioned that the whole world has learned from the pandemic experience, and in India particularly, the gaps in health infrastructure were identified, and a fund of about $8 billion has been sanctioned for strengthening the health infrastructure over a 4-year period. This will be a tiered approach starting from the lowest administrative unit, the block, going all the way up to the regional and the national levels. It will include epidemiological lab networks for surveillance and preparedness, 100-bed critical care unit in every district, again like a county. There will be strengthening of tertiary treatment also. In addition, Honorable Minister said that although India does have leadership in vaccine and pharmaceutical manufacturing, there is an evolving view that manufacturing has to be regionally distributed and manufacturing capabilities have to be prepared in groups of countries so that they can respond faster in the course of the pandemic. India also, if I may add to what Honorable Minister said, India also feels that there is a greater need for early stage collaboration, right from drug discovery all the way to drug development and manufacturing, as well as clinical usage and health practices. And that is why India has been advocating for more collaboration in these areas.
Should there be a G20 committee inside the WHO for this early warning pandemic?
Love, please mention.
Sir, extending from what Honorable Minister has said, as you had asked, our priorities in G20 were very specifically focused on our learnings from COVID-19. And the first priority focused on health emergency architecture for the world. what we would like to highlight, we analyze what is happening in terms of decision making across the globe. If you see, there is one process which is happening through intergovernmental negotiation body, another process happening through international health regulation reforms. There are multiple health emergency committee. There is an effort being done under pandemic fund. There is a technical committee within that pandemic fund. When all these multiple institutions are discussing on how to manage health emergencies, in management of health emergency, there is a very critical aspect, timely decision making, timely information, and the framework to decide should be very clearly established. So as I had mentioned to you, the first health working group priority is based on our learnings from COVID-19, and this is what we want, an equity in the world, an effective decision making process in the world, by integrating all those initiatives so that they are not operating in silos and they are not fragmented. Second aspect, very specifically brought out by India, is that since 70% of the diseases are primarily from zoonotic origin, so you cannot look at health emergency from a human health perspective alone. Human health, environment health, and animal health are integrated. That is where the concept of One Health has been very specifically brought onto the table by India, which was agreed by all. Third aspect which India brought on table is, as I mentioned earlier, climate change will impact health. So how do you focus on climate change and its impact on health so that we are better equipped to manage those changes which happen in the health sector? And I submitted a very clearly defined deliverable in terms of climate and health initiative is going to be launched soon with a headquarter in India. Second aspect of our health emergency management, which you had asked for, is about once you have a decision-making structure, once you have an approach, then you still need drugs, diagnostics, and vaccines. Today, in COVID-19, it was India which provided, as Honorable Minister has mentioned, vaccines and drugs to more than 150 countries across the globe. Now, when this being the challenge, the inequity in availability of vaccine, drugs, and diagnostics being so high, India has brought forth, under the direction of Honorable Minister, the fact that there is a need to have distributed manufacturing of drugs, diagnostics, and vaccines across the world. Now, when you talk about distributed drugs, diagnostics, manufacturing, you also need to talk about R&D. So we start with R&D, framework of R&D across the globe, which provide equity, framework of manufacturing across the globe, which supports equity, and then even when this has happened, in COVID-19 you would relate, there was a big challenge. Vaccines are available, but vaccination is not happening. Because certain countries are rich, they can book production twice their population. Certain countries will not get any vaccine. So how do you bring equity in that? That is where the concept of medical countermeasures coordination platform was brought by India in G20. And we realized that when pandemic treaty is being discussed, we are not aware when the pandemic treaty will get finalized, when it will be ratified. Can next health emergency, or will you think that the next health emergency will wait for pandemic treaty to be over? Definitely not. How is world going to be prepared in terms of drugs, diagnostics, and vaccine? That's where India's G20 presidency brought forth the agenda of interim medical countermeasures global coordination platform. So these are very specifically defined agenda which India brought on table based on the learnings from COVID-19. Thank you.
गुजरात वाले को कुछ नहीं पूछना है भाई.
Sir, could I go?
Sir,
My question is. Sorry, can I go ahead?
Yes, please.
Love sir, the question is to you. Two questions actually. One, you just mentioned the climate initiative that would be headquartered in India. So if you could give a little more detail about what that would encompass. And the second question is, when we are talking about the interim MCM platform or the final pandemic treaty as it happens, what were the observations or reservations that you had to face during these discussions?
So when it comes to climate and health, the most important component we talked, resilience of our health system in terms of managing climate change. And there are different components to that. The component include understanding how climate change will impact the health pattern today. Whether waterborne diseases will see change, vector-borne diseases, what changes will be seen, what changes will be seen even in terms of the heat waves. If you realize, last year, whole of Europe had large amount of heat waves related challenges. We also have challenges of cold wave these days. We also have challenges caused by earthquakes and floods. They're all related with climate and health change. So with that as a perspective, this center which will be created in India will create required understanding, evidences and approaches on how to be equipped. How should our health workforce be trained and oriented for future? What type of communication needs to be built with community on those aspects? These are the topics it will cover. On the interim medical countermeasures platform, I am happy to highlight to you that there was such a specific consensus based on what India has brought on the agenda. There are 4 very clearly defined principles which emerged when it comes to interim platform. India brought it on table and all the countries across the globe agreed to it from G20. We talked about when you create an interim medical countermeasures platform, it should be based on an inclusive consultative process. That is, everyone should be consulted. Because that was the challenge when ACT Accelerator, Access to COVID tool was made. Second, we said there should be inclusive decision-making process. So you consult what needs to be done. You create a mechanism where everyone has a voice in decision-making. Third principle it talked about is it should have effective representation of low and middle income countries in the decision-making process. So it should not be rich countries deciding alone. The recipient country should have a very specific role in terms of decision-making because they are the people who need it. Fourth very important component emerges, it should be convened by WHO. See, in India's G20 presidency, India was very clear, WHO is a UN mandated body to work on health. With that as a perspective, we said, because WHO will represent globe in health, instead of only certain selected organizations or countries representing, that is why we said it should be convened by WHO so that there is an inherent amount of equity which will be built into this platform.
Sir, were there any concerns shown regarding the side effects of the vaccines? Because vaccines were developed in a very hush-hush manner. It was needed so. So were there any concerns regarding the side effects? Because we are having so many young people dying without any any plausible reasons. So have any concerns been shown?
वैक्सीन का आज ही मैंने बहल का स्टेटमेंट देख रहा था ICMR के, वो बता रहे थे कि हमारी उसके पास स्टडी चल रही है। मैं भी भूतकाल में 1-2 बार बोल चुका हूँ। वैक्सीन की इफ़ेक्ट क्या है उसके पर इंडिया में ICMR भी स्टडी कर रहा है और दुनिया में भी स्टडी हो रही है। लेकिन कोई भी वैक्सीन जब मार्केट में आते हैं तो उसकी सारी फॉर्मेलिटी उसको पूरी करनी होती है। इसलिए कोई वैक्सीन ठीक नहीं आ गई और उसके हिसाब से कुछ गड़बड़ हो गई, ऐसा नहीं हो सकता है। चलो भाई,
Any other question? There was one question you wanted.
ગુજરાત વાળા હાલતા હાલતા કરીશું, ચાલો મોડું થઈ ગયું છે। મોડું થયું છે, પછી કરીએ, ચાલો।
Thank you, Honorable Minister. Thank you, dignitaries on the dais. We conclude this press conference, please. High tea served outside in the lobby. Please join us.